In 1930, a 19-year-old black man walked into a lab at Vanderbilt University. He wasn't a student, he wasn't a doctor. He was hired as a janitor. His name was Vivien Thomas. He had dreamed of becoming a doctor his whole life. Then the Great Depression took everything. But his surgeon boss, Alfred Blaylock, quickly realized this janitor had the hands of a god. Thomas could operate with a precision that most trained surgeons couldn't match. When Blaylock moved to Johns Hopkins, he brought Thomas with him. There, they faced a desperate challenge. Babies born blue. Blue because their heart couldn't send enough blood to their lungs. Thomas designed the entire operation. He built instruments by hand. He practiced until the technique was perfect. November 29, 1944, a 15-month-old baby named Eileen Saxon lay on the table. She was blue. She could barely breathe. Blaylock picked up the scalpel, and Vivien Thomas stood right behind him, whispering every step. The baby turned from blue to pink. The room erupted. It was the birth of modern heart surgery. Blaylock became world famous, but Thomas was nowhere in the papers. His name wasn't on the research. For 35 years, Vivien Thomas trained some of the greatest heart surgeons in history. They all called him their real teacher, and for 35 years, Johns Hopkins paid him as a janitor. In 1971, those surgeons came back. They hung his portrait in the hallway he once wasn't allowed to walk through because of the color of his skin. In 1976, Johns Hopkins gave him an honorary doctorate, 32 years too late. He invented the surgery, he built the tools, he taught the surgeon, he saved thousands of babies, and they paid him as a janitor. Justice came, but it made him wait a lifetime.